This short video deals with making a doctor's appointment, telling a doctor how you feel, getting medications, and going to the drugstore. Just some simple sample questions or ideas that I put together that may be of help to you. There's also an accompanying PDF right next to this video, which you can print out and get the document that you see here. First of all, the doctor's appointment. Obviously, you have to call in most cases to make an appointment, and these are a few suggestions on how I would do it. When you call, you'd say, I'd like to make an appointment with the doctor. If you know the doctor's name, Dr. King. The nurse will ask you, when would you like to come in? Or when do you want to come in? And then there's a lot of different scenarios here depending on the urgency of your problem. You can say, I'd like to come in as soon as possible. You can suggest a time, right away, as soon as Dr. King has time. Does the doctor have any time today to see me? If you want to suggest a time, how is for this afternoon? Many times you just want to know when is the first available appointment, and this is how you would ask that right in here. The nurses will always tell you this: if it's an emergency, go directly to the emergency room. They don't want to see emergency situations in a doctor's office. The reason for that, obviously, is that they don't have the equipment to properly diagnose an emergency. They're there for treatment, not for emergency. So many times, even in when you call a doctor's office, the first recording that comes on will tell you that if you have an emergency, go directly to the emergency room of the hospital. Obviously, the emergency room is very expensive, so most people don't want to go there, and their problems aren't that urgent. And in this case, you're just asking for a doctor's appointment. If you can't get to see the doctor that you regularly see, then this is a way that you can ask for another doctor. Is there any other doctor that can see me sooner? If they say that your doctor can't see you for 3 days and you have a problem you want to get addressed right away, this is a quick way to ask that. Also, alternatives to emergency rooms are urgent clinics. These are usually covered pretty extensively by insurance policies with lower deductibles, out-of-pocket expenses that people have, and usually don't need appointments either. And they do have diagnostic equipment that many hospitals also have, but you don't have the high overhead costs that emergency rooms have that are at hospitals. So insurance companies try to, unless it's an absolute emergency, don't want you going to the emergency room because their fees are very, very high. If you have an urgent problem, they have urgent clinics that you can go to that will address your problem at a considerable price savings over an emergency room. Once again, if it's not urgent, a routine exam, routine problems that you're having with your health, then you want to call to make a doctor's appointment. The nurse is going to be asking you, or the person fielding the phone call will be asking you a variety of different questions, and there's a variety of different ways that they will ask how you're feeling. I put a couple of these ways that the nurse may ask you that question here. And then for the next 2 pages here, I go into a couple of different ways that you can help describe your problem that you're having. Many people will say, my stomach hurts a lot, my head hurts, my chest. Hurt is used much more than ache. So, my stomach hurts, my head hurts. The nurse or the doctor will ask you, does it hurt a lot? They want to know the degree of how much it hurts. How long has it hurt? How long has it been hurting? Typically, where does it hurt? Does it hurt a lot or a little? Here's other ways of saying it. I hurt my foot. You just simply substitute foot for other parts of your anatomy. They'll probably ask you, how did you hurt it? How long ago did you hurt it? Or how did it get hurt? They'll often ask you at a doctor's appointment to bring in a list of your medications, or bring in your bottles of medication. Generally, what I do is I just take a picture with my phone of the bottles of medication that I take, and that will have the name of the medications and the dose that you have for that medication. So when you come in, they want to know what medications you're taking, so that when they prescribe something, it doesn't somehow have a bad effect with your medications that you're taking. This page just deals with a lot of different ways of trying to explain your problems, common problems of headaches, stomach aches, sore throats, pains in your chest. I feel sick in my stomach is hurting me, my throat is hurting me. People tend to express hurt. My stomach hurts me, my throat hurts me. These are a variety of different ways of saying it also. I have been having trouble or problems or difficulty, and these are the symptoms: breathing, sleeping, seeing well. I've been having trouble with my heart, with my knees, with my blood pressure. These all indicate that an ongoing problem I am having. So it's problems that you're having that you want to get addressed by the doctor. Some indications are that you break your leg, you sprain your arm, you bruise your leg. Many times people go in because of cuts. I fell and bruised my knee, I cut my knee, I hurt my knee. Headaches are obviously a big symptom. I have a big headache, a really big headache. The migraine headache is obviously the worst, migraines. This is simply a little, joke here. The doctor really can't help you, but my girlfriend broke my heart, or I'm heartbroken. People also deal with high fevers. Sometimes a cold, the flu, a fever you want to get addressed by the doctor. If you're trying to guess what your problem is, I might have broken my wrist. I may have broken my wrist. So this is, you're not sure if you broke it or you sprained it so you're guessing them. They'll ask you why you're sick. I have sharp pains in my stomach, chest. So then they will go to the medications or medicine that you're taking. Medications and medicine is the same word, has the same meaning. The doctors will be asking you, have you been taking any medications, any medicine or anything? If you've been taking something, I've been taking aspirin, or you just tell them what medication. Or many times if you're the negative, I haven't been taking anything. If you want to ask them if your stomach hurts you, what can help? Is there anything, or is there something I can take to help it? Or is there any medicine I can take to help it? Another common question asked to the doctor is, what can I take to help it? What can I take to make it better, feel better, help me to feel better? there are two types of medicines. Some the doctors have to prescribe. Those are called prescriptions. And other drugs can be bought at your local drugstore. These are called over-the-counter drugs. For example, aspirin, things that you take for heartburn, things you take for a cold. So if a doctor gives you a medication or suggests something, you want to know, is it a prescription, which means he has to write it down and you have to bring it to a drugstore to fill, or is it over the counter? Can I go to my local drugstore to get it? Many times they say, you can get it over the counter at the store. Sometimes, especially pain medications, it's prescription only. Or you'll need to get a prescription from your doctor to get that medicine. So two types of medicines, the one we're all used to just going into a drugstore to get, and the ones that you have to go to a doctor for them to prescribe. In the pharmacy, the nurse is going to be asking you, which pharmacy do you use? Where shall we send the prescription, or do you have the phone number of the pharmacy? Because they'll call in the prescription for you. So they want to know, the pharmacy. Sometimes they want to know the address or the location or the phone number. So this just helps them to process the prescriptions quickly. After people get prescriptions, many times they have to get what they call refills, which means, they give you a month of medication or 5 days of medication, and you need to get a refill because you need more. The pain doesn't go away. So you'll just ask, at the pharmacy, I need to get a refill of my medication. And instead of medicine, you can be specific. My blood pressure medication or my heart medication. They, of course, check your records to see if a refill has been authorized by the doctor, or if you need to call the doctor to have them call the pharmacy again. When you're talking to the pharmacy, if it's already been, you bought your drugs there one time, to get the refill, you just say, I'm calling to get a refill of my medication. Medications have different doses. The word dose, how many milligrams. And they may ask you, how many milligrams is your medicine? How many milligrams is your heart medication, is your blood pressure medication? They may ask you, what is your dose of heart medication? If you know the medication's name, they'll, what's your dose of Cardival, which is a type of heart medication. When you don't have any more pills left, the way that you convey that is you say, I ran out of my pain medication. I ran out of my cholesterol medicine. Or you can tell them the name. I ran out of my Lipitor, which is a medicine for diabetes. So with refills, I need to get a refill of, and the medication's name. Sometimes if you're not sure, you have to ask them, do I need to call the doctor to call in the refill? Because if the doctor called in a prescription and it was only for 30 days, the pharmacy will not refill your prescription if it wasn't authorized the first time. So if they only authorize it for 30 days, you'll have to call your doctor back to have them call the pharmacy to get the medication re-prescribed for you. Sometimes you want to know how long do I have the medication for? The doctor says he's going to give you pain medication, but you want to know, is it a 30-day supply? Is it a 5-day supply? And another question you can ask the pharmacist is, how many refills can I get? So that in advance you'll know about that. Oftentimes on the bottle itself it will say 5 refills, 2 refills. So basically these are some sample questions for you if you're not familiar with dealing with doctors in English, how to make the appointment, how to tell them what's the matter with you, where you hurt, talk about the medications themselves, what can you get to help you, and then when you get to the drugstore to ask them about getting the refills and the various doses that they have prescribed you. Thank you.